if you can't find a functional medicine doc, honestly, a good naturopath will do just as well in most cases. But we're going to look at the thyroid much differently. So the average conventional doc is going to look at your TSH, which is thyroid stimulating hormone. And they're going to look maybe at your T4, which is a prohormone. But in reality, your T3 is the only active thyroid hormone, and the conventional docs don't look at that at all. And so I had what looked like a normal thyroid labs when you looked at the ones that you look at, but when you looked at the actual thyroid function, my labs were in the toilet. So my T3, I should say. And so I was started on a thyroid medication, and it literally changed my life just as much as estrogen did. I actually started taking thyroid medicine before I started taking estrogen. And it was a total game changer. And so the other thing I noticed is that a lot of women in particular are affected by Hashimoto's, which is an autoimmune condition that affects the thyroid. And Black women are more predisposed to have autoimmune conditions. Women in general are 2 to 4 times more likely, depending on the autoimmune disease, to have it than men. So it's, again, any disease I'm finding that affects women more than men tends to not be as either paid attention to, or we're just not getting all the information that we need. But you definitely need to talk to a provider. The typical conversation I hear from my patients is, oh, my doctor told me my thyroid labs were normal. So in the book, I do break down all the labs that are really necessary, because like I said, if you go to your OB-GYN or your just general practitioner, internist, or whomever, they're going to just probably run a TSH and a T4. They're not going to screen you for Hashimoto's. They're not going to look at your free T3. And they're just really not going to be thinking about it. But that is a significant thing that happens, especially in women over 40. And a lot of people have been suffering their whole lives with it, and it hasn't been diagnosed. So it's an important thing to consider. And then the adrenals, are, again, a whole nother animal, but your adrenals really are responsible for just your ability to have a stress, or to create cortisol for your stress response. So the classic analogy is the fight or flight, the saber-toothed tiger, but now we don't have the tigers. We got the bosses, we got traffic, we got irritating people, we have school shootings, we have all types of things that are affecting our stress level, just listening to the news. So that puts us in this constant fight or flight kind of space where we are constantly really running our adrenals. And so over time, our adrenals get tired. And so that is considered in the functional medicine world, integrative medicine world, considered adrenal fatigue. We've just kind of drained our adrenals. But most people have some combination of some issue with a little bit of thyroid dysfunction, which can be fixed oftentimes just by correcting your vitamin D levels. Vitamin D and iron and magnesium are probably the 3 most common minerals and vitamins that are deficient, and that really significantly affect our thyroid function. But I have seen patients that, especially patients that have a lot of melanin in their skin, or they just don't absorb because vitamin D is converted through the skin. That's why I do believe, and they've shown that patients that died from COVID, like none of them that they had actually looked at their vitamin D levels, none of them had vitamin D levels under a certain point. Vitamin D levels are important for our immunity, to decrease our cancer risk, for all of our hormone function, all the things, blood sugar, like it affects everything. And so, and our ability to fight disease, especially infection. So vitamin D is another one. You want your vitamin D levels, in my opinion, to be at least 50. Ideally in our world, it's 60 to 80, but I see so many people with vitamin D deficiency, and then their doctor tells them to take it, and then they take it, and they're like, okay, and then they stop. But you can't stop taking it. You've got to keep taking it. It's the only vitamin that our body makes. So just think of it that way. It's probably important if it's the only vitamin that our body actually makes.
You know, Dr. Arianna, I know, and we're looking at the time, and I'm listening to you. I'm like, oh my gosh, if we had another half hour, and you're probably saying, well, yeah, but we don't. But if we had some more time, I would love for you just for 1 minute just to talk about, because the book also talks a lot about self-care. And, I love the latter part of the book that talks about a healthy, sexy glow. And looking at this part of our lives as a life to, what do you say? I think you call it what the latter 40 years of our life or something like that. But what can you share with women, encouraging them, that also ties in with what you talk about in the book, so they'll know what what to look forward to, but where they can find information around self-care and so forth in the in your book?
Okay, that's a loaded question.
I know.
But it's fine. I wasn't even looking at the time, but it's all good. I have a few more minutes if you're,
Okay.
I mean, it's okay. I'm okay. So if you
Okay.
guys, what time do you want to,
Well,
tell me?
we had a schedule till 2:30, and it's 2:28 now. So perhaps, and if people could just hang on with us for another maybe 10 minutes, I don't know. I think that might, what do you say, Cheryl?
Yeah,
I think that would be helpful.
space to answer this loaded question. Yeah.
It is a loaded.
Right.
So I tried to condense it. I got thumbs up, and if anyone else, give us a thumbs up. But please, Dr. Arianna.
Okay.
Well,
I'm trying to figure out.
well, you know what? That I'm going to take a step back then, because what I
Okay.
really wanted to talk about, and to be honest, you talk about gut health and inflammation at the core of about every disease there is, right? Even so, the gut is one of the most, you say, one of the most neglected organs in the body. Could you just give us a description? What is inflammation, and why did you decide to address this topic so thoroughly? I knew it would take a little bit more time, but